Good afternoon, everyone, and welcome to our Just Culture Roundtable discussion. My name is Professor Lisa Chico, and I'm one of the nursing faculty here at Franklin Pierce University. I'll be serving as our moderator today. I'm honored to have with me two of our MEPN Master's Entry into Practice Nursing students, Diana Connors and Sophie Allen. I want to start this roundtable discussion by introducing two women to you, Redonda Vaught and Charlene Murphy, whose lives would tragically intersect on December 26, 2017. On this day, Redonda Vaught, a nurse employed by Vanderbilt University Medical System, assigned to Ms. Murphy's care, administered the wrong medication, resulting in Ms. Murphy's death. You'll hear more throughout this discussion about the circumstances leading up to this tragic event, detailing a multifaceted drug medication error. I think it would surprise many of our viewers to know that every year, over 100,000 medication errors in hospital settings are reported to the FDA. This is not a new phenomenon. On November 29, 1999, the Institute of Medicine released a report called To Error is Human, Building a Safer Health System, describing a very large number of hospital error deaths resulting from medical errors. The writers of the report believed it could not address the overall quality of care without first addressing a key component of quality, which is patient safety. Almost 20 years after this Sentinel report was written and significant safety reform has been implemented, errors still happen, resulting in innocent victims like Charlene Murphy. So, with these questions, we have some questions. Who's responsible for the errors that are leading to patient deaths? Who should be held accountable? And how can we learn from these mistakes? These questions help structure an experiential learning opportunity for our senior MEPN students as part of their immersion class. The class was charged with recreating the Redonda Vaught criminal court case. Half of students were divided into the prosecution and half the defense. We thought it would be meaningful to highlight some of those arguments for today's roundtable discussion. And for today's discussion, Diana will serve as the prosecution expert, and Sophie will provide us with the defense's expert perspective. So this case made national news with major nursing organizations such as the American Nurses Association, the Tennessee Nurses Association, American Association of Critical Care Nurses, the New York Professional Nurses Union, and others coming out in support of Redonda Vaught. In fact, the American Nurses Association was quoted in saying, "The criminalization of medical errors will not preserve safe patient care environments." So, given that, Diana, let's start with you. Tell us why the state of Tennessee felt compelled to prosecute Redonda Vaught for Charlene Murphy's death.
Thank you, Professor Chico. Yes, thank you. As part of the prosecution, our team had to make the case to the jury that Redonda Vaught was guilty of criminal negligent homicide and gross neglect of an impaired adult. So let me explain this a little bit more for our audience. Redonda Vaught made critical mistakes that led to Charlene Murphy's death. Not only did she violate all the safety guidelines of medication administration, she also did not act ethically when she just left her patient after giving medication. Redonda Vaught was taught the 6 rights of medication administration in nursing school. Rodondava, like every other nursing student, learned the 6 rights during fundamentals. The 6 rights are the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. In addition, nurses learn to check with a pharmacy or a healthcare provider if they don't know the drug. And every nurse is taught that medications are dangerous and even deadly if they are not administered safely. So here is what she did. Radondava knowingly ignored all the warning signs. She did use VE instead of the entire name. She did not verify that the medication she pulled out of the medication dispenser was the correct one. She ignored the warning, paralyzing agent, bright red cap. Radondava ignored the warning label, gave the medication anyways, and went back to her station. Charlene Murphy would be alive today if it weren't for the gross neglect and reckless actions of the defendant. The nurse is the last failsafe before medication administration. A patient is counting on the nurse to protect him or her from harm. A patient is counting on the nurse to follow protocol and stay with him or her, to check vital signs, to provide some comfort, and not just leave. Nurses spend a large amount of time with patients and serve as their advocates, as their confidants, and as their protectors.
So, Sophie, given that, it seems that Radondavat bypassed some fundamental checks. How do you respond to that?
Yes, thank you, Lisa. Radondavat definitely made many big mistakes, but really the mistakes she made are not that uncommon. Medication errors are a huge problem in healthcare. We give out unprecedented quantities of pharmaceutical drugs, and part of creating a safe process requires hospitals to create safety protocols, such as having scanners in place and using generic medication names only. I'm sure we all have certain expectations when we enter a hospital. I certainly do. Expectations that nurses will follow safety protocols and protect me from injury and illness, but also expectations that the hospital fosters an environment with safety as the #1 priority. Vanderbilt did not have a culture with a focus on safety and error reduction. Vanderbilt University Medical Center had huge deficits in safety protocols in their hospital. For example, this medication error happened in the radiology department of Vanderbilt Hospital. In this department at Vanderbilt, there were no medication scanners and no way to access the patient's chart. There was no way to verify the patient or medication at the patient's bedside during medication administration. This is a huge safety issue. Also, there was very likely insufficient staff training in the use of Omnicell in Vanderbilt Hospital. Omnicell is the automated medication dispensing system that Vanderbilt Hospital used. Leading up to Radondavat's error, it was common practice at Vanderbilt to use the override feature to retrieve medications from Omnicell. The override feature is not something that a hospital should allow to be overused, because this is the feature that prevents wrong medications from being dispensed. Vanderbilt was aware of the overuse of the override feature, but did nothing to intervene. Another safety issue was that Radonda only typed in 2 letters before the Omnicell was populated with medication choices. This is a problem that needs to be addressed. Proponents for increasing safety have suggested that nurses should have to type in at least 5 letters before medication can be dispensed. This could prevent a huge number of medication errors in the future. A big issue I have with this case is that the brand name of Versed was discontinued in 2003, meaning that wasn't technically even a name for the medication she was tasked with retrieving. The prescribing doctors should have been using the actual name of the medication and the name that populates in the Omnicell, midazolam. Radondavat was actually tasked with retrieving a medication that didn't technically even exist in the Omnicell. And finally, Vanderbilt University Medical Center did not report the medication error to the state or federal government officials, and the Vanderbilt physician misled the county medical examiner, stating the cause of death as natural, preventing an investigation and an autopsy. The focus of blame can't solely be targeted at Radondavat. She played a role in this medication error, but the hospital and medical systems at large should also be analyzed for their role in this tragedy.
Thank you, Sophie. That's really, really enlightening. And so, Diana, I guess my question for you is, Do you agree with the defense's argument that the hospital was as much at fault as RaDonda Vaught?
No. Um, to me, it's the nurse who follows the medication safety protocols and not the hospital. Here, the nurse violated all the safety checks in place to keep the patient safe and from harm. For the audience who doesn't know vecuronium and what it does to you, so let me explain what this drug actually does to you. Intended was a medication to help with anxiety. Instead, Charlene Murphy received vecuronium. Vecuronium has a big red cap that states, warning, paralyzing agent, and there is a reason for that. As our medical expert testified, vecuronium takes only 1 minute to show signs of paralyzing action. It needs to act that fast because a patient needs to be intubated. Vecuronium is given before general anesthesia in preparing you for surgery. Vecuronium helps to keep your body still during surgery. Within 1 minute, you lose the ability to talk. Every muscle relaxes. You are not able to breathe any longer. RaDonda was not there to observe anything. She gave the medication, she ignored the warning labels, and she went back to her station. She easily could have seen the onset of paralysis after 3 minutes. She didn't even stay 1 minute. Any other nurse would have followed hospital protocol and stayed with her patient for the first 15 minutes, not RaDonda. She did not stay to observe to make sure her patient is okay. RaDonda acted reckless, and her neglect did cause the death of Charlene Murphy. Therefore, the state of Tennessee was correct to charge RaDonda under Tennessee Code Title 39, Chapter 13-212, which establishes the criminally negligent homicide. Criminally negligent homicide is a Class E felony that does carry a possible sentence of 1 to 6 years in prison.
So, Sophie, Diana clearly makes a strong argument that RaDonda Vaught bypassed some safety checks and ignored fundamental medication administration principles. I guess that ultimately led to Miss Murphy's death. Do you believe she should be held accountable, RaDonda Vaught, for her role in Charlene Murphy's death?
Lisa, I want to answer that question, but first I want to say something about hospital culture. Hospital policy, protocol, access to technology, and organizational culture all have the power to either support or undermine patient safety. To reduce medical errors in practice, we need hospitals to promote a culture of accountability. In this case, RaDonda Vaught's voluntary reporting of her mistake was the only report on file. She was the only one to report this error. On December 26, 2017, RaDonda Vaught, using a system wrought with errors, ignored by the administration, was ordered to administer a medication dangerously prescribed by its brand name, retrieved the medication using an override feature in the Omnicell AcuDose, which was common practice on the unit. She then found herself tasked with administering a medication in an area of the hospital where she did not have adequate resources. I can't argue that RaDonda didn't make some serious mistakes and that her actions didn't contribute to Charlene Murphy's death, because they did. That's undeniable. Yes, I believe that there should be consequences for RaDonda's actions, but what consequences? She was punished when she lost her job at Vanderbilt, and then again when she had her license revoked. Do I believe she deserved these consequences? Yes, definitely. I think her error was grave enough that having her license revoked was fair punishment. That happens. When nurses make huge errors that result in harm to patient, often the loss of a nursing license is the result. It's not typical, though, for medical professionals to be tried in criminal court. This should have remained in civil court, where it has historically in cases like this. I don't believe the guilty verdict that concluded this criminal trial was a step forward for increasing patient safety and nursing accountability.
Thank you for that. You know, and I think it's important for our viewers. You both have had very compelling arguments for the prosecution and for the defense. But I think our audience would like to know how you both feel personally about this case as new nurses entering the profession. So Diana, I'll start with you. How do you feel personally about this case?
Well, going through the nursing program myself and completing all the exams, all the clinical rotations, taken care of patients myself, it crossed my mind that it easily could have been me. I gave medication to patients many times. However, I also know that there are many safety steps I have to take before I actually can give medication to my patients. As nurses grow in their roles, responsibilities and accountability for sound clinical judgment grows. Radhonda Waugh learned that ethics are at the basis of sound clinical judgment. Despite a healthcare environment that is complex and presents a countless number of ethical challenges, ethical theory and principles still provide the moral framework for sound decisions. Radhonda Waugh was that as a nurse, that ethical decisions are concerned with right and wrong. The most common ethical principles that provide the foundation for nurses are confidentiality, fidelity, veracity, autonomy, beneficence, justice, and yes, non-malfeasance. Do no harm. So going back to the safety checks for a second, those safety checks are in place to help nurses not to make mistakes. Radhonda Waugh admitted that it was kind of odd that the medication she pulled out of the medicine cabinet was a powder. She knew that something was wrong, but she ignored it anyway. Radhonda Waugh's action was far from clinically sound. I know I'm going to repeat myself, but the nurse is supposed to be the last failsafe. Do no harm is the most sacred principle for nurses.
Thank you, Diana. And, Sophie, so how about you? How do you personally feel about this case?
Well, Lisa, I think that this case is all too familiar. There are thousands of medical errors happening each year in this country. This one just happens to be under public scrutiny. Lisa, we know according to the US News and World Report that medical errors are the third leading cause of death after heart disease and cancer. Can you believe that? The third leading cause of death after heart disease and cancer. And then we also have professionals from Johns Hopkins University School of Medicine speaking about how this is a systemic-wide failing throughout the entire medical field. As you mentioned, Lisa, in your introduction, To Err is Human was a really important report done by the Institute of Medicine all the way back in 1999. This report called attention to the huge problem our country has with medical errors in hospitals. 20 years ago, this problem was brought to our attention. This report, which was done by the U.S. Committee on Quality of Healthcare in America, didn't suggest that the solution was to point fingers and punish the individuals making these mistakes. The solution to the problem the report suggests is increased data collection, which comes from a healthcare culture that promotes truth-telling, especially around medical errors. Increased data collection with the purpose of error prevention, and not just one hospital. This needs to be at a systemic level. The responsibility for reducing medical errors is not just the responsibility of individual medical professionals. The administrative level of hospitals needs to be promoting a culture of safety, and this needs to be structured and supported at the state and national level with the design of a safer system. There really won't be any real kind of solution to these huge numbers of medical errors if we don't. If this country chooses to focus on punishing individual professionals, especially ones who had absolutely no ill or selfish intent, we are moving away from a just medical culture. Just culture is incredibly important to healthcare and has the aim of protecting healthcare staff and also creating meaningful quality improvement. Just culture in healthcare is a culture that promotes open reporting. Open, honest reporting of errors so that systems can be designed to reduce errors. We are moving away from a medical culture that promotes quality improvement through data collection. We can't collect data on mistakes that hospital staff are not owning up to because they are scared of being charged criminally. This is actually the opposite of what Harvard Medical School suggests, which is to implement a national database of medical errors. The purpose of this huge database, dedicated specifically to medical errors, is to be used for nationwide research on improvement and prevention. If we continue to maintain a culture of blame and punishment, full honest disclosure of medical mistakes is not possible. If we criminally charge individuals like Radhonda Waugh who make mistakes, we are criminalizing mistakes. This could lead to a hospital culture of dishonesty, cover-ups, and subsequently divert the focus away from systemic improvement. Let's remember this: Radhonda Waugh knowingly created a report of her mistake. so that it could be used for quality improvement. If we criminalize mistakes, reports like this won't happen and we can't learn and make changes to improve the chains of failure.
You know, Sophie, you bring up such a good point, and I think a point that is central to this case and really important for nurses out there to understand. I want to give you an opportunity, Diana, to talk a little bit more about this idea of just culture that Sophie started to talk about when she was just making her remarks.
So after the report "To Err is Human" was published, many people were shocked about the huge problem we have with medical errors in our hospitals. Looking at this discussion and the points from the defense, I believe we are equally shocked that not much has changed in the past 20 years since then. There are still over 100,000 medical errors in hospital settings every year. Radon War made a fatal medical error that cost Charlene Murphy's life, but is Radon War just adding to this number, or is there more to this discussion? I think this discussion is as much about medical errors as it is about being human. As the defense pointed out, Radon War reported her mistake. Why did nobody else speak out about all the safety violation and shortcuts at the Vanderbilt health system? What kind of work culture are nurses exposed at Vanderbilt? A just culture helps create an environment where individuals feel free to report errors and help the organization to learn from mistakes. Vanderbilt clearly did not just have a just culture because they shifted the blame entirely onto Radon War, treating her as the problem versus conducting a root cause analysis and drilling down to the system's problems. We actually had, at the end of our mock trial, we actually had a discussion about the importance of a just culture. A just culture includes open and honest sharing, supporting those involved, offering an apology, agreeing to remediate and correct to prevent further injury. To err is human, but we only can prevent errors if we as nurses feel free of blame and punishment when we do report an error.
I couldn't have said that better, Sophie and Diana. And I'd like to close this roundtable with a special thank you to our senior MEPN students who put in a significant amount of hours to create incredibly convincing arguments for both the prosecution and defense. And I also really would like to take this opportunity to especially thank Diana and Sophie for going above and beyond to develop this roundtable discussion. They, like their fellow classmates, recognize the significance of this case and the compelling need for nurses worldwide to learn from it. Thank you for joining us today. And if you have any questions about any of the content in this roundtable, I'm sure Sophie or Diana would lend their expertise. Have a wonderful day.